Hello, everyone. I see 9 people are here already. Just gonna set up this stream before everybody else joins. And whoever's joined already, I'd love to hear from you in the chat box. If you could just drop in your name and where you're logging in from, that would be wonderful. Hi there, David. Sorry, it's very weird to have this one-way communication, so I'd really appreciate messages in the chat box. Hi, Pranoti. Nice to see you. Hi, Minaz. Hi, Viresh. Hello, Amit. Hello, hello. I'm Minhas from Tamil Nadu, Coimbatore. Very nice. My mom is from Coimbatore. Hi, Garima. Nice to meet you. I'm just going to let a few more people join before we begin. Hi, Ganesh. Nice to meet you. Hello, Kiletso. Nice. How are you folks doing? Is it hot or cold where you are? I'm in Goa, India right now, and it's very, very hot. So if you're in a cold region, please let me know so I can think about nice cool breeze. Hi, Vineet. Just a minute more. People are still trooping in. It's cold in Uttarakhand. Very glad to hear that. Enjoy it while it lasts. Evening. Yes, I can understand. Downpour is good. It's better than hot and dusty. All right. I think we've waited enough. I think more people will troop in over the next few minutes, but think we should begin. So, just to start off, let me introduce myself. My name is Aditya. I'm the Senior Director of Operations at Fortify Health, which essentially means that I oversee the operations team, which means finance, HR, admin, logistics, all of it. So that's really what I do. And what I will do today in the time that we have is run you through a very quick presentation on one, the broad problem or the context that Fortify Health works in. Two, a little bit more about the organization itself and the various teams and what they do. And then third part is largely focused on this internship program and very specific details, expectations, timelines, and things like that. And at the end of the presentation, I'd be happy to take questions. There are folks from our team here, from the comms and HR team on this call, who will jot down any questions that you may have, and they will shoot it to me over here on Slack, and so I can pick out some of those questions and respond towards the end. But hopefully, between this webinar and the JD that we've shared already, which I hope everybody has gone through, I think most of your questions should be answered. So, with that, I think I'm happy to begin. Let me just share my screen here. And there we go. All right. So, really, to begin with, the broader context that Fortify Health works in, and that is the challenge of anemia. So, there's a large population, especially of females aged 15 to 49 in India that are anemic. And to just put things in perspective, that's about 20.8 crore people, which is the combined population of two of the most populous states in our country. So, just in terms of numbers, this is a widely prevalent issue. But what makes it even more sort of serious is that 2 in 3 children under the age of 5 also suffer from anemia. And the challenge is insidious because this leads to losses in physical and cognitive development in kids. So you would have heard of a variety of cognitive development issues, neural tube defects, cerebral palsy. A lot of these developmental issues stem essentially from iron deficiency anemia. So these are, problems that are very, very pervasive, have a deep impact, but aren't really spoken of as very serious issues. Now, the solution to this is fairly simple. It's really a well balanced, healthy, nutritious diet. So you can see here in this image a variety of food groups represented. And if one were to consume a diet full of these food groups, then you would not have an issue of iron deficiency and anemia. But unfortunately, the reality of the country and the reality of our world is that most people either don't have access to or can't afford to have this kind of a complete balanced diet. Um, Now, the solution to that problem is really fortification. And what fortification means is just, essential micronutrients get added to staple foods, micronutrients like iron, folic acid, and vitamin B12. Fortification is not a new idea. It is not an idea that Fortify Health has come up with. There are many programs in India as well as around the world where staple foods have been fortified for a very long time. And Fortify Health specifically focuses on wheat fortification. So, not only is fortification a very direct solution to the problem, it's also extremely cost effective. So, for 100 rupees, we can fortify about 1 ton of wheat flour. Now, you can imagine how many families, how many women, how many children 1 ton of wheat flour can feed. And so the amount of impact you can have for a relatively small cost is tremendous. So the cost benefit ratio of fortification is extremely, extremely high. So that's to give you a very sort of broad context of the problem of anemia, the impact it has on the lives of families, especially women and children, and a very sort of direct solution that is available, that exists for a very long time, which is fortifying staple foods. So perhaps now I can move a little bit more specific to Fortify Health. This is a picture that we took recently at our team retreat. You can see me there in the left, bottom left. Um, Now, most organizations have a vision and mission, and a lot of the times these are just branding terminologies. But for Fortify Health, these things have a very key role to play. Uh, the way we work is we have the vision that guides the mission, that guides our 5 year strategy. The 5 year strategy guides our medium term strategy, which then guides our 6 month programs, OKRs, and which guides each and every individual's day to day work. So everything that I do, or the comms team does, or the HR team does, is in some ways tied to our broader vision and mission. So these things here are very important. Every single word in here has been really very deeply thought through, and it has a very specific meaning. So you'll see the specific focus on micronutrients. That is an area where Fortify Health specializes. In our mission, you'll see the focus on wheat flour and iron deficiency anemia, because there are many different types of anemia. What we are specifically focusing on is tackling iron deficiency anemia through micronutrient-rich wheat flour. So, these slides very important. You can find this data on our website as well, but it has a deep importance and meaning to all of our work at Fortify Health. Secondly, just a broad sort of setup. We work as a project within an FCRA registered organization in India called Development Consortium. We have similar arrangements in the US as well. Our team is spread across the country. We also have global teammates. Most of our work is remote. There are some roles within teams, such as programs or partnerships, that require people to be in a physical location, but most of our work happens largely remotely. So, just building on the theory of change a little bit and figuring out how Fortify Health's work leads to that goal of reduction of iron deficiency anemia is the inputs that we provide are there is capital support, there is technical support. Through these two ways, what we are enabling the industry to achieve in terms of outputs is large scale distribution of fortified data. That's one. And the other is doing that while meeting extremely high quality standards. So those are, in essence, what you could call the outputs of the inputs that we are providing. The outcomes is reduction in levels of anemia, and there's lots of analysis and data out there on how wheat flour fortification leads to a major reduction in anemia rates across the world. And the impact is really a healthier world. And a big part of that is healthier children, healthier women, healthier families. And so that's really the goal or the impact that we're working towards. Now, how we do this, and that's where we we start getting into really the nitty-gritties of how the Fortify Health team gets its work done. So, primarily, these are the three technical departments in the organization. So, I'll take you through them one by one, and we'll go a little bit deeper into each one over the next few slides. So, the open market mills. This is any mill out there that's fortifying, or rather, that's producing wheat flour on a large scale. We work with these mills to help them fortify their wheat flour so that, through their distribution channels, we are reaching a very wide ranging and large section of the population. So that's our work with the open market mills. With partnerships, really what we're focusing on is working with governments, NGOs, and quasi-government organizations. And in an effort to help them fortify the wheat flour that's going out through the public distribution systems, the social safety net programs, etc. And with evidence generation, really the focus is on doing research, monitoring, and evaluation so that we are able to build up more of a public understanding about the benefits of fortification, how fortification can be done well and to the highest possible quality standards. So these are really the three key prongs of Fortify Health's approach. So going deeper into the open market. So broadly what we do is support millers to cost neutrally fortify chakki atta. Now what that means is for a miller, there is absolutely no cost to fortify that atta. We provide them with the capital support, we provide them with the technical support, we train their staff in how to fortify. So we provide them all of that. In addition to that, we also provide them with marketing and advertising support. So really, we're making it as easy as possible for these millers to be able to fortify as much wheat atta as possible. Now, in terms of outputs, there are some very large numbers here. We're working with more than 115 mills across India at the moment. About 30,000 metric tons of atta is being fortified per month. 30,000 metric tons is a large amount. And this represents about a 3x growth over the last 18 months. And our goals for 2025 are even more ambitious. In terms of outcomes and impact, there are various metrics and various processes through which one is able to understand or measure what the outcome or impact of all this work is. In our case, we estimate that we've reached about 6.5 million beneficiaries across India. And I would like you to note this number down because it ties into the goals that we have set for ourselves for 2025. There is another metric represented here, which is the aversion of years lived with disability. This is a very specific metric, and fortification, especially the work that Fortify Health is doing, has resulted in about 19,000 years or about 300 lifetimes averted of people living with disabilities. So these are some, again, very clear indicators that show us how Fortify Health's work and its model is actually benefiting people in the country. The partnerships team, like I mentioned, we work with state governments to mainstream wheat flour fortification in the safety net programs. Every state has their own safety net program. They have their different priorities, different mandates. And our job, or rather the partnerships team job, is to go out and convince them to fortify any wheat flour that is being sent out through these safety net programs. We also work with NGOs and quasi-government organizations that work with large populations and that supply them or provide them some form of flour, whether it is directly wheat flour or providing them with food that is made using wheat flour. So, and some of our current partners, we're working with the Andhra Pradesh PDS system, the Madhya Pradesh PDS system, the Tribal Development Department in Maharashtra. We're trying to get this ATA into ashram schools in Maharashtra. So these are the kinds of partners that the partnership team essentially looks for or tries to work with. With monitoring and evaluation, really, it's about informing the broader public, the broader industry, about the value of food fortification, about how to do it, about how to do it well, and the outcome and the impact that we achieve by doing the right kind of wheat fortification. So under this arm, essentially we do a lot of research. We work with many of the big players in the food fortification space, as you would see from the logos here. In addition to that, we obviously have the what are called support departments, the executive team, which focuses on fundraising, communications, governance, and strategic initiatives that work across different departments. And then we have the operations team, like I mentioned, finance, procurement, HR, everything that goes into supporting the work of the three technical teams that you saw on the slides before. So, very ambitious goals by the end of 2025 is to really build a market for wheat flour fortification in India to support more than 25 million Indians. So you would have noticed December 2024, we've reached about 6.5 million. So what we're looking at is about a 4x growth within this year. And the goal also, if you notice the terminology here, it's building a market. We're not aiming to do this by ourselves. We're very much involved in building coalitions, building a support system within this space, so that we can pull in our efforts and try to do a lot more than each of us could do individually. So really the goal is not just Fortify Health, but also other organizations. If we could build the right partnerships, if we could work with the right people, how do we get more and more fortified wheat flour to as many people in India as possible? A more realistic goal is 25 millions, but obviously we would like to scale this nationwide. Now, specifically talking about you, or rather the applicants to the internship program. So this is now, let's say, the third variant of our summer internship program. The first time we did it, it was very chaotic, ad hoc, last minute. The second time, last year we did it, was a lot more structured, very similar to this program. And we've had a history of interns joining Fortify Health full time after their internship programs. So from the last year's program, we have at least two people. From the previous year's program, we had two people who joined us full time as well. So what I want to communicate is that this is a very serious internship program. We hire interns as a way of identifying and developing talent in the market that can work with the organization over a long period of time. This is not going to be just a easy breeze. So that's something that you can put on your resumes. Um, there will be a 2 to 3 months very specific project. You will be working to deliver outputs. So you're expected to deliver certain deliverables that will actually tie to Fortify Health strategy, to Fortify Health's work, and very much the option to transition to a full-time role. So the end of the internship, we do a quick sort of feedback and review process. And if there is a need and if there is a strong performance, there is all likelihood that you could be offered a full-time role at Fortify Health. So here, I just want to list out some clear expectations. So from Fortify Health, what we will do is provide you with clear tasks, deadlines, deliverables, expectations, everything upfront. You will have all the necessary background information. We will respond to your questions, provide you feedback. You will be fully included in the functioning of the department. So while you're working on a project, doesn't mean that you'll be working just all by yourself. So you'll be fully included in the functioning of the department. And really, you should look at this as a learning opportunity that also you're learning while also contributing in real time to an organization's vision and mission, which is in many ways a very unique opportunity. From you, what we expect is that you bring your full efforts to the project that you're working on. Having an inquisitive, growth-oriented mindset, being very, very open and communicative, because this is a two-way street. While we provide you feedback, you also need to provide us feedback. You need to communicate very clearly and openly within your team, but also ask for help when you need it. So we do not force feed people here on what they need to do. Things will not be broken down to the most granular level. We are expecting that you do bring something to the table. You have a certain skill, you have a certain expertise that you bring to the table, and this is an opportunity for you to practice that skill or show that experience. I've listed up some example projects here, but I would really direct you to the JD, which has a lot more detail, which will give you a sense of the kinds of projects that are currently ongoing at Fortify Health. You'll also notice in the application form, we've asked you to select a preference between the different departments. Please don't select a 5 for all departments or a 0. That just tells me that you've not read through these projects. I would really encourage you to go through the JD, read through the projects, look at the descriptions of all of these departments, and really pick something that interests you or that aligns somehow with your expertise or skill set. So please do refer to the JD for more details on the kinds of projects that you would find within each of these teams. Finally, we received a fair few questions on what the eligibility for this internship is. I would like to clarify that anyone can apply. It's not restricted to just students or early career professionals. Like I said, our model is that you will be given a real project to work on. So as long as you have the skills, as long as you have the right attitudes, you're more than welcome to, for anybody to apply. In the past, we've had interns who were transitioning from the private sector to the public sector. We've had people who are doing their PhDs. We have students who are interning. So it's a very wide group of people that we've worked with through the internship program. We're also open to global candidates. There is a little bit of a time restriction because a bulk of our team is based out of India. If you're working with one of those teams, there has to be some level of overlap with those teams. Therefore, the sort of time zone requirement. But in the last internship program, we had people from Kenya, we had people from Indonesia, we had people from the UK, even from the US. So very much open to global candidates, and our goal is really to pick the best possible candidates out of the list of applicants. And the third key thing is really the ability to work on this for at the very least 12 weeks. So oftentimes I get inquiries from people who say, oh, I only have 4 weeks. Can I still apply for this internship? And the reason we have this requirement is because it takes a bit of time for a person to enter an organization, understand how things work, and then really start working on something. And the projects that you'll be working on are really relevant and important to the strategy of the organization. So it's really hard for anybody to get anything meaningful done in that short period of a time. So 12 weeks is what we ideally look for. Plus or minus 2 weeks is fine. So anywhere between 10 to 16 weeks is really the ideal internship period that we're looking for. So if that is not something that works for you, I think that will be a bit of an issue when you apply. Finally, next steps and timelines. So applications will close by the 17th of March. Originally in the JD, we had mentioned the 21st of March, but we've already received a lot of applications. So we want to move the process forward, and therefore we will have to close the applications by 17th of March, which I believe is next Monday. The work test then will be sent out by 21st March. Work test basically will have one key activity that we will ask you to do, which will help us gauge which team you would be best suited for, and to see your skills in action. Um, then that will be followed by one interview with the department leads and the person who will be line managing you so that they understand you a bit more in person. That will happen largely in the first 2 weeks of April, following which we will go into contracting, and we would like the interns, the final candidates, to finally join us on the 1st of May. So these are the clear timelines that have been specified, and that we will go through over the next few weeks. That was really it from me. I'm happy to go through some questions. I think my team has already shared some details with me. I have applied for an internship. When should I expect feedback or an update? So we are reviewing applications at the moment. Once the applications shut early next week, we should be able to respond or update all the applicants on where their status is. Unfortunately, we can't give feedback to each and every applicant. We have more than 600 applications at the moment. We also have 13 other job descriptions online right now. So, unfortunately, we won't be able to give you detailed, minor feedback, but at least we will let you know if you've not made it through to the next round. Start date of the internship, like I just mentioned, 1st May is really what we are aiming for. Uh, Field work. I don't believe there will be a lot of field work involved. It totally depends on which team you're a part of. But the way we've envisioned this internship is it'll most likely involve desk work, doing research, analysis, and putting together really these documents for the review and reference of the various other team members. Um, would it be possible to join from June? It's hard to say. It'll totally depend on your application and your fitment with the rest of the teams. We are hoping that all of the interns start together in May, because then it lines up with our projects and timelines, etc. as well. But please do apply, and if you are a good fit, I'm sure that we can make some exceptions. 2 months is really what we're looking for at the very least. Slightly more than 2 months is what I would say. Again, I'm not discouraging you from applying. Please, by all means, apply. But really, to know that it takes a while for a person to settle into a large organization and then start really working through all of the nitty gritties of the project. So I would encourage you to think about maybe a slightly longer time. Qualities, experiences that would make an applicant stand out. Well, Fortify Health is very data and evidence oriented. We are very collaborative, communicative, and very much straight to the point. So these are things that we highly, highly appreciate. So if you're able to represent that kind of those kinds of values through your application, then you will definitely stand out. Also, being authentic and taking the time and effort to respond. No matter if you use ChatGPT or not, that doesn't matter. Really, what matters is that you've thought about your response and you've structured it in the right way. So that may be a way to stand out, really. It is largely remote. The work is online. Timings are, we don't have fixed work timings. Between 9 a.m. and 6 p.m. is when everybody works. But during that time, people are taking different times off. Somebody starts at 9, somebody starts at 10, 11. It really depends on the team that you join and the rhythms and schedules that they have. Also, the project that you're working on and who you're working with. But we do not have fixed working hours. We will not expect you to start at a particular time and end at a particular time. We work according to outputs and outcomes. So if you're able to finish all your work in the time that has been promised, then we have absolutely no concerns what time you start working. In pa, 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 specific to Indian population, yes, our work is entirely based in India at the moment. It is looking at wheat flour fortification in India. So no, it is not global in that sense. Work time flexible with a surety to complete the task on time. Yes, I believe I just answered that. Flexible working hours. Yes, I believe I answered that. Um, can we change team preference after? Uh, I don't believe you can, but if you don't mind dropping a message to our recruitment ID, we can see what we can do about that. Can I know when the internship starts? I already answered that once, and it's on the presentation, May 1st. 250 words couldn't describe the purpose in much detail. Well, that is the trick. How do you describe your purpose in the most concise and direct form possible? So please try again. You can most certainly use ChatGPT to help you with that. It'll help you cut down your responses. It'll help you structure your words better. But really, the content should be there. Your thinking should be there. And I'm very certain that you can fit it within 250 characters, not words. Internship opportunities around the year. For now, we are not doing internships throughout the year. We only do the summer internships, and then those interns get converted into full-time employees if they perform really well. Um, so at the moment, we don't have plans to do around the year internships. Limited to wheat products. It's not limited to wheat products. It's limited to wheat flour. We fortify wheat flour. That's really the goal and the focus of our work at Fortify Health. A full-time master student, can I apply for this position? Um, You could. It will be difficult. It totally depends on how well you respond to the time pressures. But there will be some requirements to work during the day with the rest of the team. So it's very hard to answer. It's very context dependent, but it would seem difficult unless you're really good at managing your time and you have a flexible school schedule. We will shortlist your profiles. There are many other questions in there. Really, the questions on your motivations, the questions on why, what skills are relevant to this. Those are a lot more important to us than what is in your CV. That tells us whether you understand the work, whether you understand the organization. We may ask for your CV at a later stage, but at this time, I think we have enough information to make these decisions. No, we do not do fortification in rice, oil, or other staples. As you would have seen in the presentation, um, we are very much focused on micronutrients and wheat flour. There is enough work for us left to do just in those fields. There are other organizations working in rice, oil, and other staples who are also doing a fantastic job. But for us, I think there's a lot more to do before we leave the wheat flour world. Number of candidates. We are aiming to go for one per department, so we're looking at anywhere between 5 to 6. But some departments sometimes go for more than one intern as well. So at the very least, five. Field work will not be required. It's very unlikely that we will send you out into the field. Our work is very, very specific. It requires a long time, lots of training before you're able to actually do it. So a lot of the internship work will focus on, like I said, desk research, analysis, putting things together, communication materials, things like that. Wow, no more questions. Any other technical skills? Well, you should be able to think, you should be able to write, you should be able to find information, organize information, and communicate that information. As long as you're able to do that, you would fit right in. We're not looking again. This internship is not about deep technical expertise. You don't need to know anything about food technology or fortification in great amounts of depth. But really, what you need to know is how do you find information, organize it, and share it in a way that other people can consume and interact with it as well. I think we can take a few more questions before we close. Provide recommendations. We can provide you with whatever kind of documentation you may require that suggests that you did perform this internship. That should not be a problem. Mandatory to communicate in English. Not exactly. It would totally depend on which team and the people that you're working with. A large part of our team is based out of India. They speak and are very comfortable in Hindi. We also have members of the team that do not speak Hindi. So it's really a mixed bag. But you should be able to communicate in English at least because it allows you to communicate with various members of the team. And Hindi is obviously very beneficial. Regulatory affairs, possibly, yes, as part of the program team. There could be some work with the reg team. Online meeting. Yes, because we work remotely, we do end up doing a lot of our work over meetings. So, yes, there will be lots of meetings during working hours. Again, depends on what project you're working on and how much you need to interact. But one of the other eligibility things is you need to have some setup, a laptop, access to internet to be able to do this internship. Management internship, then you should apply for an executive or operations team roles because that's where a lot of the management work goes on. Data analyst, if you're interested in data, the M&E team is what you should be really looking at. Specific skill, I believe I've already kind of answered multiple times. If you've already selected departments, that's fine. At the end of the day, we will do a matching based on your skill and the departmental requirements. So it's fine. You just need to let us know what you may be interested in. So as long as you've picked something, that's okay. The key stages, there's only one interview. So there'll be a work test, like I mentioned, which will test some of your written skills, your analysis skills, and then there'll be an interview where somebody will gauge how you work and interact with different people, and that will be enough for us to make a decision. I can tell you a lot more about the partnership department. It'll take me all day, but essentially they do a lot of research on people that they can meet in the government, state governments, national governments. They do a lot of research on NGOs and quasi-government NGOs that they can speak to. They go out and talk to these people and try and convince them to fortify Vitata. So, in a nutshell, that is what the partnership team does. Standardizations on the device. Not really. I don't really understand the question. Company culture. Well, some of it I mentioned earlier. We're very data and evidence oriented. Everything is meticulously thought through and discussed before decisions. Many people say that they're not hierarchical. I would say we are functionally hierarchical, that there is a org structure, there are hierarchies, but the way work happens, people are very, very friendly, very, very collaborative. We are fully remote, so there's a lot of bias towards communication, being very effective and communicating very, very clearly. And my favorite thing about working with Fortify Health is really the people. I think we have some of the best people across all departments. Everybody is very kind, very friendly, very, very helpful, which just makes the whole experience of working with them so much nicer. Fee charged for getting the internship? No, absolutely not. We don't charge any fees for you to do the internship. In fact, we will pay you a salary to do the internship. So, not sure what that meant. The program department, again, um, in a nutshell, it works with open market. It works with millers. It works to get as much fortification out there as possible. And that is essentially why it's called the open market team rather than the program team. Yes, absolutely. ChatGPT is there. I use ChatGPT. Everybody in this world uses ChatGPT. But it's also very easy to tell when the answer is given by ChatGPT and not by you. So the way to use ChatGPT is you have to structure your thoughts first, and then ChatGPT will help you organize that content to a certain extent. So it's very easy to understand. So yes, absolutely, you can use ChatGPT. Throw light on the consultancy fee, please refer to the JD. It's all listed out there very, very clearly. All right. I think that's about it. Um, if you have any more questions, please feel free to reach out to our HR team on the recruitment ID mentioned in the JD. Just know that we are processing a lot of applications, and we want to make sure that we go through each of the applications and get back and actually begin this internship on time. So we may be a little slow to respond in some cases, but happy to answer any more questions that come up. I would again ask you to read through the website, read through the JD. It has all of the information that you may need. So I believe we with that we can end this stream. Thank you everyone for joining. Some from India, some from outside. I hope you have a good rest of the day, evening by now already, and look forward to getting your applications through this process. All right. Well, see you everyone. Bye bye.